When you first find out that you or your loved one has celiac disease, you may be shocked. No one likes to hear bad news. And, as so often happens in this type of situation, you may recall little other than the words celiac disease from the conversation you have with your doctor that day. Over the next few days and weeks, your mind may race nonstop as you mull over your new diagnosis and try to come to grips with it. Or, if the diagnosis is brand new to you, perhaps you are right now in the process of trying to deal with the news. Celiac Disease for Dummies provides you not just with the facts about celiac disease, but the tools to help you master it. In this chapter, our goal is to help you understand and come to terms with your diagnosis. Getting to know celiac disease. Celiac disease, also known as celiac sprue, non-tropical sprue, and gluten-sensitive enteropathy, is a condition in which consuming gluten, a protein found in wheat, rye, barley, and some other grains, leads, in susceptible people, to damage to the lining of the small intestine, resulting in the inability to properly absorb nutrients into the body. This can lead to many different symptoms, including fatigue, malaise, feeling generally poorly, bloating, and diarrhea. Left untreated or insufficiently treated, celiac disease can lead to damage to other organs. If properly treated, celiac disease typically leads to nothing. Technical stuff. In your travels, you may see the word celiac spelled as C-O-E-L-I-A-C. Both terms refer to the same condition. C-E-L-I-A-C is the spelling far more commonly used in North America, and hence the spelling we use throughout this book. Incidentally, the term celiac comes from the Greek word chela, which refers to the abdomen. Doctors have known about celiac disease for a long time. Articles describing individuals suffering from diarrhea, most likely due to what we now call celiac disease, first appeared over 2,000 years ago. It was, however, Dr. Samuel Gee who, in London, England, in 1887, first described the condition in detail and even, presciently, observed that successful therapy was to be found in changing a patient's diet, although he did not point to gluten as the culprit. That came later. See the Discovering Celiac Disease later in this chapter. Knowing how having celiac disease feels. It could well be that you were diagnosed with celiac disease after having been unwell for quite some time. If so, then when you read this section's heading, Knowing How Having Celiac Disease Feels, you may have said to yourself, hey, I can tell you how it feels. It feels crummy. I had belly pain and I had indigestion and I had... Yep, those things sure can happen. But so too can many other symptoms. Or on the other side of the spectrum, few or even no symptoms at all.